Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. We are going to start talking about our unique species, which are feline. And today's topic is more than a pet, understanding the fascinating reproduction of cats. Feline reproduction is very unique in a way that this is the seasonally polyestrous animal, which means that the female, the queen, comes at particular season of the year and happen to be long days and short nights. So she comes in season or in heat during that time, here at least in northern hemisphere, in the United States and many of the European countries. I've been told in some Asian countries that seasonality does not apply. So I just want to make sure that I'm talking from US perspective. And then this animal is also induced ovulator, means that she needs to have some kind of stimulation induction. Obviously, in this situation, if queen is met with, tomcat and breeding takes place, then she will ovulate. Now, why we think about all these different things? Because there are some unique behaviors in the queen when she comes in heat or estrus. She has a tendency to call. She calls especially during nighttime, and if there is a tom close by in the neighborhood, he also responds. So they keep on calling to each other. Queen, get all anxious, and they don't want to see this keep on. Queen keeps on calling, so they try to bring the queen to you, and then you can induce that ovulation by different ways. And one of the most common one is to give gonadotropin releasing hormone to do that. Now, just a basic understanding, please. So, stay with me on this little graph, which looks kind of crowded, but I'll try to simplify as much as I can. On this graph, on the vertical axis on your left or right, you could see there are numbers, and they represent the amount of hormones that estrogen and progesterone are produced. And the horizontal axis is a time frame. It's a kind of old, diagram, and it was really introduced by Dr. Lofstad from Prince Edward Island Veterinary College many years ago, but it still is useful. So the yellow or gold lines you see, that represents each cycle of about 20-21 days, which means that queen comes in estrus, and then if you don't breed her, she stays on for about 20-21 days, and then that follicle which is producing estrogens goes down, and then she quits coming in estrus, and then she comes back again. So this goes on during that particular season until she ovulates. So let us, if you look at the graph, as you can see here, up on the top, there is a sign of male, and there is an arrow which going down. So it's telling us that if you breed the queen with the tomcat, then what happens is that estrogen goes down, and that follicle which is ovulated now becomes luteal tissue in it, so it becomes corpus luteum. So the corpus luteum start producing hormone progesterone, which is pretty typical in most of our mammals we deal with. So that progesterone, as you can see, is a green kind of line there. It goes up all the way up there, and then comes down when parturition or queening takes place, which is about 62 to 65 days or so. As you can see on your right hand side, the green line goes down. Now, that's a tricky one. So you see a little red line in the middle. Now, what that means, what it says here, PSP, which means pseudo pregnancy. So if this animal gets pregnant, then progesterone stays on, goes down at the parturition, as I mentioned. But if she doesn't get pregnant, then she goes in false pregnancy or pseudo pregnancy. So you can see down there the timeline about 42, 45 days, that progesterone goes down, and then she starts all over again. So there's a difference between a pseudo pregnancy, here and the real pregnancy. So just keep in mind, because I'm going to talk about this very unique case, which is very relevant here. So Cleo, the name of the cat is, she's Himalayan breed, about 3 years old. Her complaint was that she loses her pregnancy when she gets pregnant. Now, how it happens? Well, let us look at the history of this animal, the Cleo. By the way, the picture you see is not Cleo, but the first picture I showed you, that is Cleo. So she was born one of the 6 kittens. So the first estrus came in was she was about 6 months old. By the way, it's owned by a very reputable feline breeder when I used to work at Tufts University in Massachusetts. So I know this breeder very well and very successful feline breeder. So anyway, so she came in estrus when she was 6 months old, and then she has had 3 estrus in about 15 months or so. She was bred with a proven tom, which means that this is a tomcat who has produced many litters before. So she bred her with the proven tom, and according to the owner, Cleo gets pregnant, but she reabsorbs her pregnancy. And after now, she's presented to us when she was about 33 days post-breeding. So with this kind of history, I think the first thing we have to do is to try to confirm if she's pregnant, because you never know. So we went ahead and start talking about doing some pregnancy diagnostics. But before we do that, the client gave, again, a very interesting piece of history. What she said was that after about 30 days post-breeding, her appetite goes up, and her belly size start increasing, which you would imagine that when an animal gets pregnant, both things happen. And then she started pinking up. Now, what is that pinking up? Well, the pinking up is that the nipples of the cat, they start becoming kind of pinkish. What it means is really that blood supply starts going to the nipples and they become pinkish. So the clients, the cat owners, think that now the cat is pregnant because her nipples are engorged and become pink. So this is what called pinking up, means first indication for the client that probably the queen is pregnant. Well, but she says about 40 days or so after breeding, her appetite goes down, so is the belly size. And, she starts kind of appearing depressed, and no vaginal discharge, any fever. We ask a lot of questions. She said nothing of those sort. And then about a week or so, then she's back again in estrus. So I really want you to look at this information. And based upon which I just showed you a minute ago, that graph, does Cleo fits on that or not? That she gets bred with a tom cat, and then, she gets pink up, and then clients think she's pregnant. But then why she goes down, about 40 days or so? Well, before we go to the answer, let us do the ultrasound on her. What we find is that there's no sign of pregnancy. What we found is as you can see, the fluid looks black on ultrasound. So you have this tubular structure, which is most probably the uterus, which is full of fluid. And there's no evidence of, any kittens or any embryos there. So we said, well, maybe there's some problem with the, dates and this stuff. Let's come back after about a week or so. And she did. Same findings, nothing else. Now, you remember what we talked about. So look at the graph again, would you please? You see how that estrogen is going up and down, up and down, up and down. And finally, she gets bred, and then progesterone goes up, and here you go. You have the PSP, which I mentioned, the pseudo pregnancy, and that progesterone goes down about 40 some days. So what do you think? Well, obviously, this female is not getting pregnant. We talked about so many different options to the client. Can we do one test or other test? Finally, I told her, I said, uh, ultimate thing would be that we can do quick exploratory surgery and try to figure it out what's going on there, if there's any problem with the uterus. Well, but she said, no, no. When it comes to knife, I don't want to have my queen, go through all that. So she took her home and bred her with different kind of toms. She had, I think, 3 or 4 tomcats at that time, but she did not get pregnant. And I told her, I said, please, if you decided to have her spayed, I like to get my hands on the reproductive tract to see what's going on. And she kept her word. After a while, she got really tired of breeding her over and over. And here we go. So she had her spayed, and here is the reproductive tract. So look at it carefully. If you look at the right horn, which has got segmental aplasia, so you can see on the top where these horns are, as you can see, the uterus is full of fluid. This is what we saw on the ultrasound. There are 2 ovaries. You can barely see those ovaries other than the left side part of the ovary. Then uterus come down and meets at the cervix. So on the right horn, you see from cervix to that piece of horn, there's nothing in the middle. So piece is missing, which is a segmental aplasia. Okay? So obviously, if you put a sperm there, it's not going to go on the right horn. Now look at the unfortunate situation of the left horn. Well, the junction between left horn and the body of the uterus was non-patent. It was not open. It was closed for some reason. So really, the left horn is closed and the right horn is segmental aplasia. So this really, sperm cannot go anywhere. So if you conclude this whole thing, I would say that this animal had normal estrous cycle with successful mating and ovulations, because we had the evidence of corpus luteal on those ovaries when we looked at the reproductive tract. Progesterone was being produced, and diestrus was about 40 days, and then there was no fertilization. So with that, this case was so interesting that with my colleague, pathologist, Dr. Schelling, and I, we published this case a long time ago, as you can see here, published in Veterinary Record in 1992. So if you want to know more about it, you're welcome to look in the library and, pull out this article, which has got much more additional information. So with that, I'm going to stop and invite your questions and comments. Please go ahead and send me some questions on YouTube channel. I'll be happy to answer those. Until then, stay safe. Bye-bye.